Hi, everybody. Welcome and thanks for watching today. I am Lauren Peretti and I'm with Housing Innovations, and we are the training and consulting firm that monitors PATH projects on behalf of the Connecticut Department of Mental Health and Addiction Services, also known as DEMIS. So I know that there may be some folks who are new today, so I'll try to explain all of the acronyms, starting with PATH. PATH stands for Projects for Assistance in Transition from Homelessness, and we'll talk more in a minute about what that program is. So before we get started, this is our agenda for today. We'll just do a really quick background in case there's anybody that's brand new to all of this that's watching, just to make sure everyone knows what I mean when I say monitoring. Then I will talk about what's new in how we are going to be monitoring Connecticut's PATH programs in 2023. I'll also go through some training resources and tools that are available to Connecticut's PATH programs. And we'll talk about what to do if you watch the webinar and you still have questions. I'm talking about things that you're not sure of, you don't understand. We'll talk about how to get all of those questions answered. So first, we'll start with a little bit of background to make sure we are all on the same page. So PATH is a federal program, and it is funded by the U.S. Department of Health and Human Services Mental Health Services Administration. So that's quite a mouthful. And so during today's webinar, I will just refer to our federal PATH partners as SAMHSA. And SAMHSA provides funding to the Connecticut Department of Mental Health and Addiction Services, which I'll refer to as DEMIS. And DEMIS in turn takes those PATH dollars that they get from SAMHSA, and they fund 5 nonprofit agencies in Connecticut to provide street outreach services to people experiencing homelessness. And you all, the folks that are watching, are likely staff at one of those 5 agencies. DEMIS also provides funding through a contract with Housing Innovations, the firm that I work for, so that we can provide training and technical assistance and also do some monitoring for PATH programs. So SAMHSA actually requires that DEMIS monitor all of the PATH projects that they fund every year, and Housing Innovations conducts that monitoring on behalf of DEMIS. So why do we want monitor? Monitoring really is an assessment of whether your projects that are getting PATH funds are following the funder requirements. So both SAMHSA and DEMIS have certain requirements for projects that get this funding stream, and Housing Innovations does a review of each of those PATH projects to help you and to help DEMIS understand the extent to which your programs, your policies, and your practices are aligned with those requirements. So it's really intended as a support for you to help make sure that your team understands what DEMIS and SAMHSA expect from you, and then also to identify maybe training or technical assistance that you guys need in order to comply with the requirements. So as you may have heard, SAMHSA is planning to monitor Connecticut's PATH program in 2023. So this year, the monitoring that we do is also a chance to make sure that in case your project is one of the projects that gets selected by SAMHSA for monitoring, that you're going to be in really good shape if SAMHSA comes out and visits. And so to that end, DEMIS has asked Housing Innovations, HI, to complete monitoring earlier this year. So we normally do monitoring in the first half of the year. This year, we're really trying to do all of the monitoring in the first quarter. So we have confirmed or proposed monitoring dates for all 5 agencies that get PATH funds, and it looks like we are going to be conducting monitoring in January, February, and March of 2023. So Demas and HI really try to make monitoring as helpful and as efficient as possible for you all, because we know your teams are extraordinarily busy doing the very hard work of helping people who are living on the streets or in their cars or in a park, helping those folks to get housing and stabilize in that housing. And we want you to be able to focus your energies there because that's what's most important. And so to reduce the burden that you all experience associated with monitoring in 2023, Demas has substantially reduced what is being monitored. So hopefully that's good news for you all. And I am going to go through now specifically what the changes are. So the first one is how we're going to handle consumer surveys in 2023. So in the past, PATH projects have been required to do a PATH-specific consumer survey and submit those surveys to Housing Innovations, and then we do some analysis and give back reports with the data from those surveys, both to programs and to Demas. So we are not going to be doing that this year. So HI will not be collecting and analyzing consumer survey data, but it is important for you to remember that as Demas funded projects, just like all of the other Demas funded projects, PATH programs are required to do some sort of survey at least annually with your participants. So because we are not going to be collecting and analyzing the data, that hopefully provides your programs with a little bit more flexibility. For example, you can decide whether or not you want to continue to use the PATH survey that you've been using for the past several years. You could also opt, if you wanted to use the standard Demas consumer survey. And you can also opt for what timing makes sense for you to complete those surveys. So the requirement is just that you do it every year, and we'll ask you when we come whether or not you've done it. And if you haven't done it yet for 2023, but you plan to do it later in the year, that's totally fine. You just need to make sure you do it at least once a year. So we have also, in order to hopefully make monitoring a little bit less onerous for your teams, we are not going to be interviewing an outreach worker or a client in 2023. We will continue to do the entrance conference at the beginning of each remote monitoring visit. So all the visits are going to be remote again. So we'll meet on Zoom. We'll ask you some questions, and we'll go through a little bit about what you can anticipate during monitoring. And then at the end of the day, we will meet again on Zoom for what we call the exit conference. And that's really where our team at Housing Innovations tells your team what we found during monitoring. So you don't have to wait to get the monitoring report. You'll know at the end of the day, what the findings will be. And it's also, importantly, a chance for you to tell us what we got wrong. So if we missed something, or you have something available that you didn't already provide, we get all that cleared up during the exit conference, and that will continue much like it has been in the past. So another piece that is hopefully good news for you all is that for most of your projects, we will likely be looking at fewer charts than we have in the past. So if you enrolled at least the number of participants that you indicated that you would enroll in your intended use plan or IUP for the period from 9/1/21 to 8/31/22, as long as you hit that enrollment target, we will only look at 3 or maybe 4 participant charts. If you did not hit that enrollment target, then we will continue to look at the same number of charts that we have looked at in the past, which is usually 5, sometimes 6 if there are subrecipients on the project. We sometimes look at 6 charts. So the big news here for 2023 is that Demas has significantly reduced, really cut by more than half, the number of standards we're going to be looking at in 2023. So as of last year, there were 48 standards in the monitoring guide. This year's guide has only 22. So Throughout the presentation today, the slides, there are green highlighted text. All of that are hyperlinks to documents on the CT Boss website. So you can access these slides at www.ctbos.org on our training page. And from there, you can click on these links to open up all of these resources, including the abbreviated guide for 2023. So all of what we're going to be looking for in 2023, all 22 standards, is clearly laid out in the guide. So there's no surprise. You can look at that in advance of us coming out, and you'll know exactly what we're going to be looking at. But just a quick reminder, the full monitoring guide is also still up on the CT Boss website. And the reason for that is that even though we're going to be looking at fewer standards in 2023, all of the requirements outlined in the full monitoring guide still apply. So DEMIS expects you to still implement those things. We just won't be monitoring on all of them in 2023. And then another just quick reminder, DEMIS has partnered, this shouldn't hopefully be news for folks. Folks hopefully have heard about this. DEMIS has partnered with the Connecticut Department of Housing, or DOH, to develop new street outreach guidelines. They're currently guidelines, they're not required yet. Alignment with these guidelines is recommended for all projects funded by DEMIS. All street outreach projects funded by DEMIS, and until your PATH contracts require until your PATH projects require implementation of those guidelines, alignment is just recommended. They will be eventually incorporated into your contracts, and then we will start monitoring based upon those new guidelines. Until then, we will be monitoring based upon the monitoring guide. So you can see here on this slide that we eliminated entire sections of the monitoring guide. So for example, we are no longer doing a visual observation. We really haven't been doing that for the past several years that we've been doing monitoring remotely. We also are not going to be looking at all of your policies and procedures. We are not going to be looking at the section on coordination with community partners or the section on emergency preparedness and response. And like I said, you can see everything that we will be looking at in the abbreviated 2023 guide. I'll just go through very quickly some examples of things we will still be looking at in 2023. So for example, under the administrative requirements section, we are still going to be looking at whether or not you enrolled at least the number of participants that you specified in your intended use plan. We will be looking at whether or not you submitted your most recent PATH annual data report on time. We'll be looking at whether or not under eligibility, for example, whether or not you enrolled only participants who are eligible for PATH services and have documented your efforts to obtain the confirmation that they do in fact have a serious mental illness. Under outreach and engagement, for example, we'll be looking at whether or not you are getting your Coordinated Access Network, or CAN, and DEMIS to approve your outreach plan twice a year as required. That's normally required in March and September. We'll also be looking at whether or not you are making and documenting consistent attempts to engage the participants that you have enrolled in your project. And then finally, under Housing First and case management, for example, we will continue to look at whether or not you are doing an assessment and service planning with participants who are enrolled, and whether or not you are using the DEMIS template, which is required for PATH programs and available on the CT Boss website on the resources page. We'll also, of course, still be looking at whether or not you're connecting people to housing, very important, to income, also very important, and to the services that they need in your community. So those are just some examples of things we will continue to look at in 2023. And again, for the full set, all 22 things, all 22 standards that we'll be looking at, see the abbreviated 2023 guide. So for the most part, DEMAS eliminated things from the 2023 guide. There are a handful of things that they added to the 2023 guide, and I'm going to go through those things with you now. The first is an onboarding plan. So we know that many of you are struggling with staff turnover when new people come on board. Having a really strong process to orient and train them is absolutely critical as they get started in their very important role as an outreach worker. So DEMAS has asked us to look at whether or not each of your projects has a plan to onboard new people, new staff, and whether or not as you hired new staff, you implemented that onboarding plan. So the training and orientation that they actually got was consistent with your onboarding plan. And these are the specific elements of an onboarding plan that we're going to be looking for. These were reviewed when HI did the supervisors onboarding webinar in 2022. So we'll be looking, for example, at whether or not someone, hopefully, who knew the clients that were enrolled in your project did a warm handoff to the new outreach worker. So introduced the new worker to the clients that they're going to be working with face to face. Similarly, we'll look to make sure that someone on your team introduced the outreach worker to all of your community partners that he or she will be working with. We'll look at whether or not your outreach worker got some orientation to your PATH program safety policy. So all of your PATH programs are required to have a written policy about safety and how your outreach workers, things your outreach workers should and should not do in order to stay safe when they're out there doing outreach, whether or not they got some training on de-escalation, whether or not they got some orientation to the new statewide outreach guidelines that we just talked about, and to the key service approaches that we use in PATH programs in the state of Connecticut. So things like assertive engagement and housing-focused case management, whether or not they got some orientation to the clients that they're serving, what their rights are, whether or not they are familiar with and got oriented to your outreach plan, including hopefully someone that knows the area that they're going to be outreaching, actually going with them to do the canvassing and orienting them to the places where they're going to be working. Whether or not they got, quick access to attended the training as quickly as the training was available and then got access to HMIS, whether or not they were trained oriented to what they're responsible for in terms of documentation in the client charts. And then, of course, we all want to have a plan for ongoing training and professional development. So as new staff are coming on board, we hope that these webinars that we recorded in 2022 are helpful as you orient and train folks. So there are 2 sessions. The links to those sessions are on this slide. The first session is really intended as an orientation for PATH outreach workers, so direct service staff. And then the second is specifically for supervisors. New supervisors really should watch both sessions, both session 1 and session number 2. And many of the things that are on the previous slide are incorporated into that onboarding webinar that we provided. So the next thing we're going to talk about is, and this item is self-assess. So you're going to basically assess for yourself whether or not your project is conducting canvassing in a manner that is consistent with your outreach plan. And then you're going to tell us whether or not you are, and we're going to put that on the report. The next item is also a self-assessed item, and that is whether or not you are meeting regularly with other providers, homeless service providers in your coordinated access network or CAN to coordinate outreach services and update your outreach plan. The next item is also a self-assessed item, and that is whether or not there is a standardized way for people who don't participate in your CAN. So that could be a librarian or a shopkeeper, to, if they know someone who is living outside, is there a standardized way for them to refer that person for outreach services, and for your partners in your CAN and you together to determine if you've got more than one outreach project in your CAN, which I think you all do at this point, is which outreach project will respond and work to engage that person who has been referred. So this item is a written policy item. It's actually the only written policy item that we will be assessing in 2023, and it's a federal requirement and something that SAMHSA may look at if they come out and monitor. It only applies to faith-based organizations. So if you're not a faith-based organization, you don't have to worry about this. But if you are a faith-based organization, you are required to have a written policy that prohibits you from discriminating against participants on the basis of their religion, their religious beliefs, or any refusal to participate in religious practices. So again, you want to make sure that you have that policy in writing. It is a federal requirement for faith-based organizations. So when we review new standards, the report will reflect whether or not you met the standard, but there won't be a finding because these are brand new standards. Presumably we would start having findings on the standard next year in 2024. But for 2023, there will not be any findings related to the new standards that I just went through. This next item is not a requirement, but DEMIS has asked us to look at the extent to which your PATH projects are using two features in the Homeless Management Information System, or HMIS. That is, those are the services feature and the referrals feature. So those are screens in HMIS where you can enter information about the services that you're providing and the referrals that you're making for folks. And then those data feed into the PATH annual report. DEMIS suspects that these features are being underutilized in HMIS, and we want you to help us learn why those are being underutilized. So if you're using them but finding them difficult to use, we want to know that, and we'll be asking you about that. And if you're not using them, we also want to understand better why you're not using them, with the goal of hopefully looking at whether or not there are some changes that could happen in those features to make them easier for you guys to use and for those data to then be pulled into your annual report. So this slide really goes through a bunch of different tools that HI has developed for DEMIS for you guys over time. And these are really intended to make it easier for you to meet all of the monitoring standards. All of these tools are posted on the resources page at www.ctboss.org. So there's some guidance on using the modified mini screen to document serious mental illness. There's a tool that goes through all of the documents that your team is required for having in a PATH participants chart. So that is hopefully really useful, particularly for anyone that's new on your team. The consumer surveys that are optional for you to use this year, you could use that, or as I said earlier, the DEMIS survey tool are available both in English and in Spanish. We've got the outreach plan template that is required for you guys, as we talked about earlier, to update every March and every September. If you're working on your outreach plan and you come to a section, maybe you're new to this and you're not sure what the template is looking for in that section, you can consult with this outreach plan sample. We've got a version of an outreach plan that's already been filled out that can be helpful as you're doing your plan for your coordinated access network for your area. And then we've got the required assessment and service plan template. So DEMIS requires you to use that specific assessment and service planning form for all of your PATH recipients, and that's posted on the website. And then finally, there's a tool that you can use to track housing placements. So, and then this slide really shows some of the training resources that are available on the CT Boss website. These are all on the training page on that website. All of them are recorded. So especially for new staff, you want to consider if it makes sense to have them watch these recordings. I won't go through all of them, but we talked already about the onboarding recording for outreach workers and supervisors. There's a recording on how you are required to document serious mental illness. That is important as SAMHSA comes to monitor. Often when you get federal monitoring, they're going to be looking at whether or not you're serving eligible people. And then there's a whole bunch of other trainings there that are listed on this slide. So, and just remember that PATH projects are required to document that your outreach workers participated in at least 12 hours of training each year, and we will be looking at that again this year. So these resources that are available on the CT Boss website can help your programs to meet that requirement. So finally, wanted to make sure that you have my contact information and Molly Machado's contact information at DEMIS. Both our team at Housing Innovations as well as Molly are always available if you need help. If you've got a question about something we talked about today, if you're looking for something and having trouble finding it on the CT Boss website. And always, we love to hear your ideas for new trainings, new resources that would be helpful to you. So you can bring those to the quarterly outreach meetings that you have with DEMIS and DOH, or you can call or email Molly or I at any time with that stuff. So that's all we've got for today. I hope this was helpful. Thank you for watching and have a really lovely day. Bye, everybody. Be well.